The meeting will 3 minutes. The meeting will begin in about 2 minutes. The meeting will begin in about All right, Tracy, I have 2 o'clock if you want to.
Good afternoon. This is Tracy Aaron, Health Education Director at the Lake Cumberland District Health Department. Thank you all for joining us for this week's update of COVID-19. We've got some members from the executive team that will be answering questions that have been submitted to us over the past 2 weeks. I do want to say if you have questions as we walk through the meeting today, please type those in your chat box and we will answer those as they appear. And Sean, I'm going to let you give us an update regarding COVID across Lake Cumberland. Yes, it's been 2 weeks since we last came together.
Yes, that's probably true. Start cutting out. Feel free to let me know. So our situation right now, we've had a total of excuse me. We've had a total of 990 cases in a day. We've have presently 91 isolated and 11 hospitalized with 102 current active cases. We've released 865. In Casey County, 653 total cases. We've released 573. We have presently 59 current cases, 10 of those hospitalized, 49 isolated. There's been 21 deaths in Casey. I didn't mention it, but we've had 32 deaths in Adair. In Clinton County, we've had a total of 501 cases. We've released 445 of those. 15 have deceased, leaving us with 41 active cases. 4 of those hospitalized, 37 on self-isolation or home isolation. In Cumberland, a total of 303 cases. 278 of those have been released, 2 have deceased, leaving us 23 active current cases with 5 hospitalized and 18 self-isolated. In Green, 594 total cases, 551 have been released, 10 have deceased, leaving 33 active cases. 2 of those presently hospitalized and 3 on home isolation. In Macquarie, 572 total cases. 461 have been released or is no longer contagious. One has one death, 110 current cases, 12 hospitalized, 98 self-isolated. In Pulaski, 2,281 total cases, with 1,944 having been released as no longer contagious. 18 deaths in Pulaski, 319 remain active, 25 hospitalized, 294 self-isolated. Russell, a total of 795 cases, with 670 having been released, contagious, 18, giving us 107 current cases or active cases, with 4 hospitalized and 103 on home or self-isolation. Taylor has had 1,100 cases, 1,040 have been released, 9 deaths, leaving 149 active, 12 of those hospitalized and 137 on home isolation. 697 total cases, 626 released, leaving or active cases. No hospitalization, Wayne, 66 on home isolation. For our district in total, we've had 884 total cases. 7,444 of those have been released. 131, leaving us with 1,009 active of about 200,000 people. 85 of them are hospitalized, 924 self-isolated. Tracy, are you hearing me okay, by the way?
Right there at the very end, we lost you some, Sean. You might want to share the total number of cases for the district again.
Okay, 8,084 total cases for the district. 7,444 have been released. 131 have deceased, leaving 1,009 with 85 of those hospitalized and on home isolation.
Okay.
Did that come through okay, Tracy?
That did, yes.
Okay, and just a couple of things that I will add. We were looking, and for the first March through the end of October, we had 4,077 cases in our district. The month of November alone, we had 3,000. So we almost doubled our first 8 months worth of cases in 1 month in November, almost doubled it. That's how, and we still hear people from town really no worse than the flu. If you look at our present of deaths in the United States, if you it would take, as far as flu deaths, you'd have to add up the last 7 years worth of flu deaths in the United States to approximate the total of where we are with COVID deaths so far. So certainly much worse. We're still having record numbers of cases, hospitalizations, and deaths. Our hospitals are becoming stretched very thin for space and supplies and staff. Emergency managements are becoming very stretched for staff. So it's a difficult time. We're right on the edge of really overwhelming our medical system, meaning our emergency management, our nursing homes, our doctor's offices, our hospitals. Very serious. Okay, Tracy? All right, thank you.
All right, Stuart, Dr. Wayman, do you all want to say anything before we start questions? Nope. Okay, so I'm going to go ahead and start with the questions. We are hearing reports of more cases of the coronavirus in Summit Manor in Columbia. Can you share the situation there, the number of patients and staff, and if there is now a COVID wing once again? As of today, the state website showed or still shows the facility with 0 active cases.
As far as Summit Manor goes, it would be better to get a situation report directly from Summit Manor instead of getting it indirectly through us. What I can say in general is that all of our area nursing homes have plans in place. They have plans in place to try to prevent COVID from getting in the buildings, and they have plans in place once COVID has gotten into the building. They have plans in place to separate the positive cases from the cases that aren't positive to try to prevent the spread throughout the building. Uh, some of the nursing homes who did, very good keeping it out early on are experiencing high cases right now. Some of our nursing homes had a bunch of cases earlier. Some of them are now having a bunch of cases again, or a lot of cases again. So, and we're seeing cases in our jails. So, this large community spread that we've had recently is really putting a real stress on these residential type settings, such as nursing homes and jails and so forth. It's if it's this widespread in the community, uh, it's very likely one of the staff will end up catching it and taking it into the facility. So uh, we don't want to give you an incomplete picture. So if you want something more specific than that, I would encourage you to talk directly with the nursing home.
Thank you, Sean. Next question. There are reports of hospitals being full, not just beds reserved for COVID patients, but also expanding the COVID wings and reducing beds for other types of care. Can you give specific details about hospital bed availability within our region and also the ventilator needs within our district?
Yeah. And much like the same with the nursing homes, it would, I don't want to paint an unrealistic picture. I can give you some general statements, but if you want to know specific details about any particular hospital, I would encourage you to reach out to them. The situations with the hospitals are very fluid. Some counties will have a large surge of cases for a few days, and then will kind of slow down for a few days, and then more cases. So it's the situation's always changing, and the number of staff they have that have tested positive or that are quarantined by being a close contact, that changes daily too. From a general perspective, all of our area hospitals are starting to be stretched really thin, some extremely thin when it comes to supplies, ventilators, and staffing. Staffing is a large concern. This time of year is a time of year when there's more demand on the hospital, flu and cold season, just naturally. And then you add the extra COVID-19 demand on top of that. It puts a lot of demand on them. The hospitals have traditionally reached out to temporary medical staffing agencies to help supplement their normal staffing this time of year. Uh, a lot of those staff that would generally be available this year at this time of year to be hired for those services, there's a lot of other people that need those staff too, like nursing homes and doctors' offices and other hospitals in other parts of the state. So you can't just conjure up medical staff out of thin air. Right now, there's just too much demand and not enough staff. So there is certainly getting to be a problem. Several of our hospitals, they've got their COVID rooms maxed out. They've got their ventilators maxed out. They're stretched very thin on their staffing situation. So again, besides those general comments, I would encourage you to reach out directly to any hospital for more specifics.
Okay, thank you, Sean. Next question. I personally see people wearing their mask and see lots of media support for masks. What I no longer see is the importance of cleaning surfaces. It used to be the large chain stores would use foggers to clean carts and I would see periodic fogging in other areas, public venues. I no longer see any of this, including the frequent cleaning of public bathroom facilities. Is this no longer necessary?
Yeah. And Tracy, you were cutting out a little bit. Maybe that's just on my end where I have a internet. Was she for you, Stuart?
Yeah. So as far as that goes, inhaling the droplets is still the highest risk with developing COVID-19. So social distancing and masking is the most important risk reducing steps that you can take. Sanitizing, even though it is a lower risk, that doesn't mean that there's no risk with surfaces. So the sanitizing should still be occurring, especially in the high touch areas like in the restrooms or doorknobs, any place where you're going to have a high touch, frequently touched surface. Most of the stores that you go to, they'll have a wiping, sanitized rags that you can use to wipe down cart handles, or you can use your alcohol-based hand sanitizer and wipe those cart handles down. Of course, you could wear gloves if you wish. It's very important to wash your hands frequently, and the benefits of that is it not only can cut down on spread of coronavirus, but also flu, as we're in flu season now, and colds. So we really want to keep everybody healthy at all times, but especially this year. We certainly wouldn't want somebody having coronavirus and flu at the same time.
Coming through on your end.
I didn't hear you, Sean. I'm sorry.
How are we coming through?
I think, okay. I could understand Stuart quite well.
Okay, and me?
You come and go sometimes. You're good right now.
Yeah, I'm sorry. For those of you had outbreaks in some of our buildings, and some of us right now, actually all of us, but Tracy, we're working remotely, so we don't have as reliable of an internet connection as we normally have. So I apologize.
Okay, next question. I would like some clarification regarding the outdoor dining option of heated tents that many restaurants are doing. Why or how is this an acceptable form of dining at restaurants during COVID? I guess that's you, Stuart.
It looks like Stuart has froze up and gone. Are you back, Stuart? You're muted if you're back.
Okay. Sorry, guys. Again, like Sean said, I also am working remotely, so my internet connection is not as reliable as it is there at our office. All right, Tracy, I did hear the question, so I'll answer that. Tents, they are allowed, you are allowed to do tents, but they have to be open on at least two sides. And then all the seating inside has to be spaced at least 6 feet apart to be considered outdoor dining. So if it doesn't meet those requirements, then you're not allowed to do tent dining. So remember, at least two sides of that tent has to be open. And the reason why tent dining is allowable is there's enough airflow with the two sides open that it can be considered an outdoor dining. And we know that the risk of COVID transmission is lower in an outdoor space. But I do want to go back and reiterate that just because the risk is lower, that doesn't mean that there is no risk. So, but again, that is allowable by the guidance right now. So,
Thank you, Stuart. Next question. Can you tell us about the vaccine that will be available soon and how safe it is? I have heard so many things that are over the top negative. Can you assure us that we are not going to be tracked, and this is just like any other vaccine that is produced and approved by CDC?
Yes, I can. So, yes, these vaccines are going to be just like any other vaccines that we've had. They will have to be approved by the FDA. And yes, these two vaccines that we are expecting any time now to be approved have been tested on thousands of individuals. There have not been any serious side effects with all these thousands of individuals. And the only side effects that have been shown are similar to those from other vaccines, such as mild fever, fatigue, muscle aches. These symptoms are due to your immune system responding to the vaccine. Means the vaccine is doing a good job. So really, you should appreciate it and expect it.
You're saying some side effects like muscle aches and things, that's just a sign that your body is reacting like it's supposed to, and it's building it's in the
Correct. Well put.
all right.
Okay, next question. Is it true our local hospitals, I think I have this, no, I'm sorry. Is it true our local hospitals, and it's got Lake Cumberland in parentheses, is out of bed for COVID patients? And what are our community leaders and the hospitals doing to expand availability of beds?
Tracy, you cut out was about you cut out on my end, maybe not on anyone else's, about is the hospitals running out of beds, and what are leaders and hospitals doing to expand their capacity?
Yes.
Yeah, so and I will say this is the last question I've had submitted. Do you have other questions, Tracy? Okay, so I don't see any typed in the chat box yet. We do have quite a few people watching live. They're wanting to submit a typed question. Now, chat. Again, to space and ventilator capacity and other supplies concern are becoming a grave at some of our area hospitals. Several of them are reporting that they're designated COVID and they may have to expand to other space. Some are requesting more support. But one thing you can't get more staff. As I said earlier, and for medical temporary staff right now. And nursing homes need those. Doctors' offices need those staff. Hospitals outside of our region, our state, need those staff because everyone's experiencing this surge right now, and community also catch the virus and have to isolate, and they're are close contacts and have to quarantine. So there's a more of a concern, or at least as much of a concern, if we'll run out of staff before we run out of space or supplies. So yes, it is a concern. It's we were on a call this morning with one of our area nursing homes. The emergency management was on the call. The the local hospital in this particular county was on the call, and it was a heartbreaking conversation. The nursing home has scores of active cases, and I don't know what percentage of their staff are unavailable right now to work because they're either sick or quarantined, but it was a large percentage. The emergency management department was short-staffed and is in several of our counties, and the hospital was short-staffed and all of its COVID beds were full. So, we're experiencing the very thing that we've been trying to avoid. And, for everyone that thinks we just need to go back and just do normal things and everything needs to be back to normal, normal during a pandemic is getting us to this point right now in our district where we're having these kinds of things happen. So we all really need to take this serious. What's the communities doing? Well, you can't create medical staff out of thin air. So what are people doing? They're trying to do the best they can with what staff they have, meaning what few staff they have are working double shifts and not getting days off. And it's there's only so long you can endure that kind of stress. If you're in a nursing home and you're having your patients pass away and there's all this sickness, and it's a really, really difficult situation. So I would ask back, what's the community doing to prevent this? Each of us should look in the mirror. Are we doing what we're supposed to be doing to prevent this so that we're not needing more hospital space and more medical staff? Masking when we go out? Are we only going out when we really need to? Are we keeping our distance from others? When we go to a store, do we just get in and out, or do we hang around? Are you avoiding crowds? We all have a part to play in this. It seems everyone themselves out. I've spoken with church leaders that continue to have church just like always. They want to. I've spoken to superintendents who want to get the kids back into in-person instruction. They want to carve themselves out. I've talked to stores and factories that, factories that want their staff back working, regardless of if they're on quarantine or not, and stores that don't want to enforce masking and distancing because it creates some conflict. I've talked with individuals that just refuse to wear masks and, carve themselves out of the response and the responsibility. All that together, the community is not functioning at a high level when it comes to doing what it takes to slow down the spread of this virus. We all need to step up. Otherwise, we're going to see our hospitals, our nursing homes, our emergency management, the medical infrastructure that we depend on, we're going to see them, stretched very thin, maybe having to postpone elective surgeries, maybe having to turn people away. We really don't want to see our ambulances not have enough staff to make runs. We really don't want to see our emergency rooms have to, make people wait for a tremendous amount of time because they're so short-staffed and overwhelmed. So, all I can say is you can't create human resources, medically trained staff. They can't make them. I mean, they have to go to school and they have to be trained. It's not an immediate process. So, we all need to do our part. Tracy, did that come through okay?
Yes, it did.
Maybe Stuart or Dr. Wayman would like to add something to my comments, but I mean, my biggest concern is what's the community doing to prevent this? Stuart,
I mean, I agree, Sean. we have, when you ask about what's being done, we have the resources we have is exactly what we have. Everybody around us, they're in the same shape. Nobody's coming to rescue Lake Cumberland. We have to do this. We have to use what we have, and that's all we're going to get. We've tried for months to tell people how serious this is. We have forecasted this. We've shown the data. If you don't know someone that's been affected now as widespread as it is, then apparently, you don't get out much. That's for sure. I mean, talk to somebody who works at a hospital. Talk to a doctor in a doctor's office. Just, if you don't believe us, talk to some of these people. This is the most dangerous time we have been in. So it is right now. So please try and try and do the things that you're supposed to do to protect yourself.
Dr. Wayne?
So
Wayman?
we know that masks and distancing work. It's been shown all year in many studies in many countries. These are very simple maneuvers for us, behaviors. It's the least we can do. It makes a big difference if everyone's wearing a mask, even if they get infected. They will have a lower viral load and they will not be as sick and they will not have the long-term consequences and they will not be admitted to a hospital. So all good. It's not 100% effective, but it is 95% effective. I just don't really understand why people are against it. And politics should be left out of this. This isn't politics. This is nature and biology.
The vaccines 90 to 95% effective. We've already, if people would consistently distance and mask, that we believe would be 90 to 95% effective. So between now and the virus or the vaccine being widely available, which will probably be late spring, early available, we really need everyone to continue to mask and social distance. Otherwise, between now and then, you know, like I said, we had our case count almost double. Well, we've still got to go through December, January, February, May. And we don't want to keep seeing our things is going to collapse long before we ever get to the vaccine if we can't keep it at bay between now and then.
So Sean, just to reiterate, because you went out just a little bit, we've seen our cases double within a month, is what you said, correct?
We saw, you know, we've been at this for 9 months, and the total cases we had in the first 8 months, we almost doubled that. And we don't want in January, well, these to keep seeing, we just can't. The medical, the hospitals, you know, the nursing homes, we can't endure that.
I don't have any other questions unless you received some, Sean, in the chat.
No, there's no question.
So Stuart, Dr. Wayman, Sean, do you all have anything else you want to share?
Well, I think we want to continue to have people mask and social distance and get your flu shot. What was you going to say, Stuart?
I was just going to say, you know, so some of the people who may need to hear this message, they're not watching it. So watching this. So if you are watching this, please share this with your friends and your family and let them know how serious of a situation that we're really in right now and what we're facing.
And I certainly apologize for our internet connectivity not being great today. I feel like we've cut. Sorry for that. Maybe by next to our normal location where we've got a much better internet connection.
All right. I want to say, Dr. Wayman, do you have anything you want to share?
No, I think we've said it all.
Tracy,
Okay, all right.
Tracy,
Yes.
Judge Cowan has actually put a question in the chat. I don't know if you can see that or not.
I see it now, Stuart. It says, once someone gets the vaccine, how long will it take to become effective to fight the virus? Dr. Raymond, that would be yours. Did you hear the question?
Yes, I did. And it's usually about 1 to 2 weeks after a vaccine that you have enough immune response to fight.
So 1 to 2 weeks after taking the vaccine. And then you'll need depending on which company, I think maybe both of them require a second shot, second dose.
Both of them require a second dose.
Yeah.
One will be 3 weeks later and one will be 4 weeks later.
Okay, well, we're
So,
just looking forward to getting the vaccine and getting on past this, just like everyone else is. We want it to be over just as much as everyone else. Let me check the chat one more time. Just thank you. I don't see any more questions.
All right. I want to say thank you all for joining us today. We will be back actually in 2 weeks, which will be Wednesday, December the 16th at 2 o'clock Eastern Standard Time. If you have questions you want us to answer, please send those our way. And I also want to let you all know that we do provide those daily updates on our website about COVID cases. Thank you all. You all have a good day.